key message is to treat COVID on day one. But similarly in the UK, what we see is as long as you're not needing an ICU support, you are okay to stay home. So in this particular situation, what people need to take, what are the little helpers that people can take being at home and dealing with the virus at home without any medical attention?
So that's a good question. So for people who don't know, we have our protocol online at flccc.net, and we have a home kit. So there's no magic bullet. It's important to emphasize there's no magic bullet. It's a multimodality treatment for both the prevention and treatment of COVID. So the first thing is that particularly, I think in the UK, and particularly as we going into winter, vitamin D is so important. We know that people who have vitamin D deficiency are at a much higher risk of getting COVID and dying from COVID. So I think people who are at particularly high risk need to be taking vitamin D. They need to be taking vitamin C. We know that melatonin, although it's a simple molecule, has been shown both to prevent COVID and very good for treating COVID. So I think that people should take that. The other thing which has become clear is that just by oropharyngeal sanitization, the virus replicates in your mouth, nasopharynx, so that you can get a simple oral gargle. It's such a simple thing to do. And there are a lot of proprietary mouthwashes that are very effective in killing SARS-CoV-2. So it's a very simple thing. You just gargle your mouth twice a day, in the morning and at night, with an antimicrobial mouthwash. So it's good for your oral hygiene and it will kill the virus. So these are very simple things you can do. And then obviously, we would suggest having ivermectin, available, which is for the early treatment. Nitazoxanide, which is very expensive in the US, but is much cheaper in other countries, is also very effective for the early treatment. So, there are a number of therapeutic maneuvers people can take. They have to be proactive. So I think, taking vitamin D, vitamin C, melatonin, gargling your mouth is a very effective way of treating this. Then if you get COVID, we obviously suggest either ivermectin or nitazoxanide, as well as providine iodine nose spray. So you spray providine iodine into your nose. Such a simple thing, because what it does is it kills the virus. And there's a recent study out of the US showing that symptomatic people, so people who have symptomatic COVID, who squish this in their nose, are 20 times less likely. Let me say that again. A simple intervention, 20 times less likely to need to go to hospital. So this ridiculous assertion of the WHO, the NIH, the CDC, the NICE to do nothing is an abomination. I think it's an abomination because there are very effective methods that people can do at home to treat themselves, prevent the disease progressing. And that's important because firstly, they don't spread it to other people. Secondly, they don't get sick and die. And thirdly, they don't overcrowd the hospitals. So you would imagine this would be an intervention that healthcare authorities would want to promote, because this would, decongest hospitals. It would open up hospital beds because you would have less sick people. It seems like they don't get it. We're 18 months into this pandemic, and the people who run these healthcare organizations seem to have their eyes completely closed.
Yes, unfortunately, this is the case, and we see the percentage of those with post-COVID symptoms reaching up to 30%. And this number it's shocking. At the charity, we try to identify any possible solutions that would help to prevent getting long COVID. With the Delta variant, how do you see it? People deteriorate from day one of catching infection, how quickly they can seek for medical support? At what point they need to, ring the bell?
Yeah, so that's a good question. So as I said, normally with the Wuhan variant, the incubation period was, 4 or 5 days, then people would be symptomatic, usually for 6 or 7 days. And then on the 7th or 8th day, they would start getting shortness of breath. With the Delta variant, it seems like the shortness of breath occurs earlier, maybe day 3 or 4. It's a really good question. So at the first onset of shortness of breath, it's very important. When you feel you can't breathe, when you're getting winded, that's when you need to seek medical attention, because it means that you now have COVID pneumonia. And the longer you wait to be treated, the more difficult it is to reverse. So, we see people who are short of breath for a week or 10 days, and then they come to a hospital, they do badly and die. So the bottom line is, firstly, when you get a fever, you start treating yourself. If you start getting short of breath, your effort tolerance is decreased, you must seek medical attention that day, because it's really important that you start treatment immediately. Those are really 2 important points. In terms of the post-COVID syndrome with Delta, we don't know. There's no reason to suspect that it would be less prevalent than the previous variants. And as you say, it's, people suffer. It's a very debilitating disease. So, if you prevent COVID or treat it early, we strongly believe that people will be less likely to get the post-COVID syndrome.
For these people who were hospitalized with the Delta and they've been getting a treatment at the hospital and now they're released and they are at home, would you advise any rehabilitation or medical treatment or any supplements, how to get them back to the state where they were prior to COVID?
Yeah, so that's a good question. So again, on our protocols, we have a way of stratifying patients when they leave hospital to try and select out those patients that are at higher risk of getting complications. One of the complications is clotting. So patients who are discharged from hospital have a much higher risk of developing clotting or thromboses. And there are a few tests that you can do, and you can risk stratify them according to the age to decide whether you should give these people blood thinning medication. The second is you can measure what's called the CRP, or C-reactive protein, and this gives you an idea of inflammation. And if these people have got ongoing inflammation, then it may be a good idea to send them home on a tapering dose of corticosteroids. And then obviously, I think it's important to, continue to take vitamin C, vitamin D, melatonin, and whatever else, they may need to restore their health.
I would ask a couple of follow-up questions so our listeners would be able to understand some peculiarities in those protocols. For example, from the very beginning, and I understand that's a very specific question, but it's very, very interesting to me. You were advocating using of methylprednisolone in comparison to dexamethasone. Well, dexamethasone was the most tested drug, so it was in recovery trial. It was well known before as a hospital-based solution for severe inflammation. So can you briefly explain to us why methylprednisolone in this case is a preferable one?
Okay, that's a very important question that you've asked. So the study in the UK, they used dexamethasone because dexamethasone was more readily available in the UK than methylprednisolone. If you speak to any pulmonologist who's been treating interstitial lung disease for the last 30 years, they will tell you that methylprednisolone is the drug of choice for treating inflammatory lung diseases.